Hello, this is Michael Keeter, the co-host with Julian O'Connor with Influential Dental and our podcast today. We're very happy and welcome Dr. Adam Hogan, who is very accomplished in his own right in full arch dentistry, as you can see with his Show Me Your Arches hat, is out of Virginia Beach, Virginia. And I don't want to talk about and give you all the accolades and talk about, but I'd like to hear more about yourself, Dr. Hogan, and you as a person. As folks know in our podcast, this is truly about who has mentored you, who's been an influence in your life, how do you influence? But feel free, obviously, to share with our audience anything about you, your companies, what you're doing, because you do have a fascinating journey. But before we get into that, I do want to introduce my co-host, Julieanne O'Connor. Again, Julieanne, thank you for being here and great to see you. Do you have anything going on this morning that you'd like to share with the audience?
Hi, I'm Julieanne O'Connor. Welcome back to everybody who's been listening and for anyone new joining us. I am what they call an influence coach in the dental space, coaching high achieving dental professionals so that they can leverage their influence and take back their quality of life. And I actually had the pleasure of seeing Dr. Hogan speak not too long ago in San Diego, and his room was packed out. And Mike, you were there with me, and we were stuck in the back. And I remember that like you were such this huge body walking in the door, and like people, you're having to duck under people. But it was so much a pleasure to hear you speak, Dr. Hogan. And I realized why people kind of consider you legendary and why you pack out all your courses and people can't get in, that it's standing room. So welcome to Influential Dental today. And thank you for being here. Can you give our listeners an introduction if they don't know who you are?
Sure. Yeah. Well, that was a tremendous introduction you guys had. Thank you very much. Great time in San Diego, by the way. Thanks for being there. Who am I? I don't, I'm still trying to figure that out in so many respects. I run a business called Implant Choice in Virginia Beach, Virginia. I'm a general practitioner, by trade, the dentist, right? The fluoride spewing, teeth brushing dentist for many, many years with a heavy focus in implants and cosmetics. And about 8 or 9 years ago, I turned our practice into Implant Choice, which focuses exclusively on dental implants and teeth in a day reconstruction, otherwise known as that trademarked all-on-4 procedure. And a few years ago, we started teaching at the Atlantic Implant Institute here in Virginia Beach, Virginia, and we teach all things full arch, really from A to Z. We've got about 6 or 7 modules plus one-on-one and live surgery training.
Amazing. I know you have something to say, Mike. Go. You first,
Yeah.
and then it's my turn.
No, that's amazing. And a lot of people know that my extensive experience in implant dentistry, working for a major company for over 18 years, now in the prosthetic space with full arch dentistry. So obviously, Dr. Hogan, what you do is life-changing to patients. And, thank you for doing that and also teaching other dentists to do that. My question our audience really wants to hear is the man or the story behind all that success and to take us back a little bit on what made you decide that this was the field you wanted to get into and to help so many people change their lives.
How did this all happen? I couldn't have planned it or scripted it like this. If you had asked me 40 years ago, so, 30 years ago, I just turned 50, by the way, just so everybody knows how
Happy
old.
birthday. Was it recent?
It was a couple months ago, but
Okay.
everybody knows that I'm old and young at the same time. I'm right there on the line. But I could not have scripted this life or this journey 30 years ago. And, there's a lot of really just hard work and not knowing where I'm going next, but always being prepared. And, the grace of God just kind of pushing me on my journey to the next best thing. I was always taught or of the belief that if that phrase luck, people say you're lucky, which is hard work meeting opportunity. And I was taught from a young age, we didn't have much growing up. I was one of 4 boys, single mom, Detroit. Happened to be blessed to go to a nice school system, though, because she worked there. And so had a good education, didn't have much in our roots, but I always decided that, I asked God if I worked hard, put me in a position where, I could make a difference in people's lives. And so opportunity eventually presented itself. And this is what I guess I'm supposed to do for now.
It's amazing. So it's funny because things seem to always work out, even if they look extreme at times. In my husband's and my life, and we have a kind of a joke that somebody said to us almost as if it was a terrible thing that we were so lucky. We were just lucky. We only had the success because we were lucky, right?
Right.
And we laughed. And at first we were like, no, you don't understand what went behind it. And then we just said, one day we were laughing, we're sitting around having coffee, and we said, you know what, let's stop defending that and just go with that. And so we always walk around going, we're so lucky. We're so lucky. Yeah. And so I have a question about that, because I genuinely see it even more so since we acknowledge that we own that yeah, we are kind of lucky, and yes, we work, but we also are really lucky. And so my question for you would be, how does mindset play into that lucky side, along with this concept of hard work and then these outcomes the way you're seeing them?
Yeah, mindset, the positivity of the mind is paramount. It's huge. It's epic. I mean, it's the only, it's what sets you apart from other people. Just the I can do mentality. I was told from a young age, you don't take no for an answer. I don't. I just, when I was in the Marine Corps, it's like that guy gets things done because nobody tells him no. They just say, I'll find a way, and that's what I used to tell my superiors too. Just you got a task to do and you move forward and you get it done. You decide you're going to go to dental school and you do it the best you can, and then you decide you're a dentist and, am I going to be average or am I going to be extraordinary? And you just keep on pushing and pushing and pushing and you work hard. It's and it's not easy, like back when you get up in the morning, that amygdala back in the back of your head, the first thing it tells you to do is don't get out of bed. It's not going to work. You're going to fail. People aren't going to like you. It's going to go bad. Like there's that doubt center in the back of your brain. And it's the first voice you hear in the morning and you have to squash it. And you have to say, you know what? Okay. Maybe I don't feel great right now, but I'm going to get out of bed. I'm going to make my bed. I'm going to get out of bed. I'm going to do my gym. I'm going to go put one foot in front of the other and hopefully it works out. And then what you find out is it worked out better than you ever imagined because you just will not be defeated.
Yeah, I mean, I love what you're saying. I know this is going to be inspiring for people, but let me just be honest. The Marine Corps is not my gig, but I have a funny story about this. So my kids, when they were pretty young, I adopted my two little ones and I have a biological older one, and they were just in this phase developmentally where they were really acting up around the house. And so one day I thought it would be funny to put them through like boot camp, like their dad went through, And so I was like, okay, for 1 week, you guys are in boot camp. And I was like, I didn't know what that meant really, but I thought this would be a good way to get them in line. And I was really serious. And I literally woke them up out of bed. They had to work to earn their breakfast and they would line up along my wall every morning. And in the back of my mind, I was thinking, they're going to tell their teacher and I'm going to get reported to CPS.
Right.
But they loved it. Like they fell in love with it. And then at the end of the week, I gave them like certificates, like they graduated from boot camp. And every morning when I would wake them up, I would go in with a video of actual clips from boot camp in the Marine Corps.
Oh,
and
cool.
It was really powerful. But there's something going on in this industry where you see a lot of people who are really grasping a hold of this burnout concept, right? And so what makes one person work really, really hard and achieve things and sustain energy versus somebody who burns out?
Well, that's a great question because I think we're all faced with burnout, and I'm not going to sit here and tell you that I don't look at burnout sometimes and figure out how to get to the next level. I mean, we all do. It's I'll tell you what, because I've been there, I've been at that, like producing and producing and producing all of these arches per month and all these implants. How many implants did I do today? And how many arches did I do this month or this year? And that is what contributes to burnout because there is no level of satisfaction. It's just like the next one. You do 100 and then you do 1,000 and then maybe you get to 10,000, right? And then, you stop counting, but like the next one is not as satisfying as the last one, right? So it's not just about the implants or about, the teeth. It has to be about something more. So, it's that, I didn't coin the phrase, but the purpose driven life, having something that you occupy your time with that's worthwhile. And for me, what really just the one thing that holds it all together for me is people, just the people. It's the change. And I'm not just talking about the patients. I'm talking about the staff, and I'm talking about people in my ordinary life, my neighbors, just everybody that gives you the drive to get up and go, because I never get tired of seeing a smile on somebody's face, right? Whether it be a patient or whether it be a neighbor, like that never gets old. So if you're doing 5 or 10 or 20 or 40 arches a month, and it's all about the arches, I'm going to tell you, it's an empty existence. It's an empty existence because, that automobile that you bought that loses its value the day you drive it, it's not as fun to get in it tomorrow or in a month. It's not, it's not. It never will be. But if you just go in tomorrow and say, okay, here's somebody in front of me, they're desperate, they're depressed, there's a gem inside that person that just needs to be polished, and that person can be absolutely amazing. And I can be responsible for that. My team can be responsible for that. that is like a purpose-driven life that you can get on board every single day.
Mike, what is it going to cost for us to get him on our team to be one of our coaches?
Yeah, no, 100%. So yeah, that was my next question. So we may want to wait till we're done with this podcast, but yes, I agree with you, Dr. Hogan, wholeheartedly. And I attribute that this quote from you because I did read in your bio: "We treat people, not teeth." Right,
Right.
and it's so true. And that's how we, as a company, Influential Holdings Incorporated, that's what we do. That's our mantra when we get up every day, Julianne and myself. It truly is about uplifting others through service, through doing right by others, and at the end of the day, that's what we have. And then you attract those same type of people, those same type of organizations, and then everyone can succeed and win. And ultimately, that patient, and that's why I've been in the medical and dental industry for all my adult life as well, about 30 years as well. I'm a couple years older than you, and I think like a young guy too. So hold on to that. But it is about those smiles, and it's about those people that now get to enjoy their quality of life. And we do change people's lives in dentistry, and all those people that are listening, whether it's a single crown, whether it's a full arch, we are changing more than just a space in someone's mouth. So I love that mindset from you. And I'm sure those around you are similar in mindset. My follow-up question on that is, you mentioned your team, and the team is so important in anyone's success. I come from a background where I played collegiate football, and obviously it was my own success, but if it wasn't for the 10 other people on the football field, we weren't going to succeed as a team. I could, a running back could run for 300 yards. Well, if the defense isn't doing it for you, you're going to lose. So
Right.
for those sports analogy people out there, but it's like that in business as well, right? It's not you're the greatness of your combined team. Tell us a little bit about that as with your team and how that's propelled you and them to new heights for your patients.
Yeah, you can be the greatest human being and clinician on the planet, and if you don't have a team that reflects that, nobody's going to know about it. Nobody's going to see it. You're never going to have a chance to demonstrate it for anybody. Your talents are just going to go wasted. We find and recruit good moral people, people that care. I say in my business lecture, my slides, I can find a job for anybody with loyalty and integrity. Okay, if they are loyal and have high integrity. So truthfulness, number one. Good moral judge of character. Two, loyalty. And now I don't mean loyalty to me. I mean loyalty to anything other than yourself or the dollar. Okay. If all you care about is a dollar or yourself, you are not a member of my team. Okay. That is not the way to get ahead. You have to buy in. You have to have people that buy in. You mentioned college. What team did you play for?
University of Oregon. It's kind of behind us here in my thing, so that's Autzen
Okay.
Stadium where I play. But yeah,
Cool.
I'm a Duck, so many years ago. But yeah, I'm still a big fan.
Sweet. I'm a duck hunter. Okay.
Hey,
Cool.
I hunt ducks too. It's all fine.
So the team is, it has to reflect you. It has to, and they all have to be pushing in the same direction all the time. And they are all equally valuable. I say this to them, it's all the time. If you look right to left and you think you're the most important person in this room, you don't have a seat in this room. You can't be in here. Everybody is equally valuable and everybody's pushing and contributing to the same mission. So, that is the most important aspect of having a team, and then having them fully understand and believe in your cause. So what are your core principles? Our team picked our core principles all individually. It's amazing. We did an exercise and they all picked, words from 100 words. They picked 5 words from 100, and it was amazing. They all pretty much picked the same words, and they all have to commit and believe in the process. And if they do, it's easy. Because if you put people in the seats that they want to be in, they're likely to excel, right? It's when you take somebody and you say, okay, I know you're artistic, but you have to do a science job. There's no way, and the salespeople are not like the clinical people, are not like the surgery techs, are not like the front office. And, thank God they're not. I tell them all the time, because I couldn't put up with 18 of you, you know, but like all of you together is a great team.
And Doc, to be fair, I'm sure they could say they couldn't put up with 18 of you, right?
100%.
Exactly. I have a question on that. So I love everything you're saying. And Mike and I do elite team training for dental practices. And this is literally spot on, exactly how we look at it as well. I also differentiate between integrity and morality, because everybody's morality, I'm not the morality police. Everybody has different concepts of that. But integrity of keeping your word when you say you're going to do something, or you want to live a certain life and you have to keep integrity with yourself, is really important, right? But these other concepts that you're talking about, people struggle with that in dental practices. And no matter where people go, they're going to have the same issues over and over until they learn these sort of foundational concepts. How do you get your team on board? Do you hire a coach? Do you do it yourself? How do you communicate this and get people enrolled in your vision?
That was not something that was easy to do for me from the get-go. I mean, even though I grew up playing sports, baseball and football, team sports, we were very good. I didn't quite understand the leadership or the coaching from the top down because I was always on the field playing. And then when I got in the Marine Corps, I went in the Marine Corps for a few reasons. One, I love my country, my God, my Corps. Okay, I wanted to do that. I turned down an engineering scholarship to go enlist in the Marine Corps because I wanted to learn how to be a better man, a stronger man, and a leader. I wanted to learn how to lead people and talk to people. And the leadership that we learned from the basic squad, fire team, squad, platoon level in the Marine Corps is the same leadership that I employ at the office, that I employ when I'm coaching my kids' teams, the hockey teams. It's all the same. You take a group of 12 people and you're going to get 12 different personalities. I don't care if every one of them was the star athlete from their school and you made an all-star team, you're going to get 12 different individuals. And it's so predictable. And it's just in the way that you direct, you expect, you hold people accountable, you empower them, you let them act, you let them make decisions, you may correct them when they're wrong, but in a private sense, you share public accolades. There's a lot that goes into, and I know I'm probably preaching to the choir with you two, but you have to manage a team deliberately, on purpose. There is no, in team interaction, there is no just passe comment that's inconsequential. Everything has a trickle down effect. Every team member that says something to another team member that passes it down, it all has a trickle down effect. Every bit of communication has to be deliberate. So, you have to be in tune and you have to listen.
Yeah. So go ahead, Mike.
No, what I was going to say is what I heard out of that is empowerment, and I've coached teams as well, professionally as well as coaching kids and stuff. And it's about empowering them to be a self leader. You can lead from the front, you can lead from the middle, you can lead from the back. It's about leading yourself to success, and again, not knowing that it's not you alone, and that there is a bigger purpose, and that is of the team. And you're right, but I do think that empowerment piece is huge from whatever job you're doing in an office or for that patient. It all matters. Whether you're greeting that patient from the front, you're seeing them out the door, you're assisting in the procedure, you're following up with them after care. It all truly does matter, and communication is the key. So I thank you for sharing that with everyone.
I have a question. So when I think about all of this conceptually, it makes sense. When we go to train, it makes sense. And people don't know how to do it. And I get that. That's a whole other process, teaching people some of what you're talking about. But my question is, even before you went into the Marine Corps, there's something from your childhood that made you say, I want to be a better man, or choose these things that are difficult, or there's something that has made you tick this way. What is that? If you had to attribute it to something in your childhood, what was your childhood like growing up, out of curiosity? Do you mind sharing?
A traumatic, probably.
As with most of us, right? But, I would say people hear us as like the pinnacle of success, not me, but you guys. They see you as this high powered, really successful person, but they can't really necessarily relate unless we know what you've overcome, or what you've been through, or why you are a way that you are that helps you. And then we can kind of enroll in how to do it. Right. So I'm just kind of curious, what's your background like?
The blessing in disguise. I mean, there are some blessings. There is some luck involved with this. I was the third boy, so I was quiet. I was a listener. A third born boy can't make any noise. The first two are always talking, right? So you're listening and you're observing, right? And it's a fact. I've got 3 children. My third is a listener. He's an observer. Probably, just like me, the smartest of all the siblings, right? Um, but I hope my older 2 don't watch this. Anyway, but I had some blessings. I went to a public school that was well off. I mean, my mom worked there. My mom, single parent, I had an absent dad. I really didn't know, didn't see him hardly at all. I went to a school where it was a lot of successful people and they're rich kids. My mom's, worked there. So it was an opportunity to see how the other side lives, to see how hardworking people live and how successful. I was always interested, what do your parents do? What does your mom and dad do? How'd they get here? That kind of thing. I was always told from a young age by my mom, if you work hard, if you study, you can be anything you want to be. So, I mean, I was like to the books, like, I got to get out of this. I mean, we did not have a good privileged childhood, and it was not fun. I mean, there was bad sides of that. Alcoholic father who was absent and gone, 4 boys who were left alone to fend for themselves, food, everything, fist fights while mom's at her second job, like all that stuff, like not easy going, life. A couple saving graces is I found out that I could be good in school. And, mom always said, if you study hard, you can be whatever you want to be, and we'll get you to college. And then, that work hard mentality. And I was good in sports, so I managed to make friends at the rich school, because of people, okay, you're on the team. So, let's all hang out. So there was that kind of thing. And I always got to see how the other side, lived. One thing I noticed was a lot of these privileged kids, they didn't really fully appreciate anything they had. Many of them, and they didn't really fully appreciate how their parents got to where they were. So, I sort of was mapping my course from a young age. Had no idea I was going to go into dentistry, implant dentistry, all on four, whatever. That is all another probably act of God, I guess. It's just me being misdirected, mistaken. I was going to do something else and then getting steered in this direction. But it's, I'm fortunate to have had a tough early young life, because I think it taught me some of the things that I need today to be successful.
Yeah, I'm going to hop in on that because Mike and I have a similar story. Both of us grew up poor. I was the one that had no plumbing and was killing rattlesnakes and skinning them. This is why I'm vegetarian, by the way. My mom cooked a porcupine in the microwave. I mean, come on, it was bad.
Wow. You
So
had a microwave?
yeah, we did have that luxury. That was our luxury. But generally speaking, I know what you're talking about. Like, I wouldn't trade it for the world, because my appreciation for hot water, my appreciation for heat are so high. I also won't live without them now. I'm just spoiled because I appreciate them so much. But Mike has a similar story too, because, he has some stuff with his family and also grew up poor and also has great appreciation and gratitude. But what would you say your secret is with dealing with people who maybe do come into your practice who have that luxury? So let's say you've got somebody who does feel entitled. Is there a way to shift a mindset of somebody who's feeling that way, and you're really interested in having them on your team? You see a potential in them, but then there's this other side that they haven't gone through that, or do you
Yeah,
just not hire them?
you're talking about team members. I think you're
Yeah,
talking
for
about
like a
team
team
members.
member.
I mean, the greatest hire is the one you don't make. I mean, it really is. So, I mean, I'm not saying that they don't have a chance, but if they can't wrap their head around the team is greater than themselves and their privileged lifestyle, then I mean, we have an issue with that. I don't really have that issue so much with, our team, in the technician area, or, but sometimes there are those lab techs or those doctors who are a little bit, I'm so important type thing. And I have no place for that at all. If you're not going to come in and work hard, I mean, I had a doctor associate who, God, what did he complain about? Doing an intraoral scan. I'm a doctor. I shouldn't be doing this right now. And I looked over and everyone else, the team was busy, like super busy and working hard and not complaining about it. And there was a patient needed a scan. And like, if you're not going to chip in, roll up your sleeves and get dirty, get out. I make it a point, if I'm a very busy guy and I don't always, but if I have a few extra minutes, I like to jump in and go, hey, let me do that scan for you. Let me do this for you. Show that you're willing to jump in and do exactly what you're asking them to do. It's a very important point of respect, knowing the team, knowing that you're willing to do it, you're willing to get in there, that you're not too good for that. I think that that's invaluable.
I came out of entertainment, and my very first film that I worked on, we had to like hoof up the equipment as I was the actor, and I had to hoof up stuff up mountains, and the director was so hardcore. And I just remember that then the next film set I was on, like, they wouldn't let you lift a finger, like they wouldn't let you do anything, and they were like handing everything, and some people just expected that. And I remember thinking, I'm so glad it wasn't reverse order, that I realized first that pitching in makes sense, and then second to that, like, I would never want to live that life of just, I mean, I'd like the cakewalk, don't get me wrong,
Sure.
but it shifts depending on how you're taught the first experience, right? In any of these settings. And you see a lot of people they're not willing to do things that they think they're above. So I admire that you do that, and that you're still, what was it? Somebody said something about the Pope, how he would go get his own chair, and I always think that that's such a beautiful thing when people are willing to remain humble. So go ahead, Mike, what were you going to say?
I mean, we're all human, and I agree with, teammates or customers or patients, right? The best patient or the best customer are the ones you decide not to work with because of all the headaches and the philosophies, and they're not good people and so on. But, at the end of the day, like you said, everyone needs to chip in. And I think also that respect of the leader able are doing it. And what I tell my kids, whatever job you do, do it to your best of your ability, whether you're unloading the dishwasher or taking out the trash, you do it, and you do it with a smile.
Yeah.
Anyway, so that is true. And I know, and I want to kind of go piggyback on that with about education, because obviously you're in the education field now. You want to inspire, lead, teach people, as well as with your own teammates. I'd like to kind of pivot there a little bit, because you mentioned earlier that education was such a big thing for you and what you sought to get you where you needed to be. And obviously you're inspiring, helping dentists get where they need to be. Can you kind of talk about the education piece and what that means to you then, what it means to you now, and what that means to the people that go through your institute and others that work with you?
Yeah, education. It's it's where I put 90% of my time into my part-time job. I love it. It's I guess about 5 years ago, maybe seven, I started having people to my office and watching and learning, and then we decided to open up an institute because I really enjoyed it a lot. It's my way of being of contributing, of being significant, because I enjoy like sharing ideas and giving people the know-how. I felt like 8 or so years ago, I was people would come in and be like, oh, you have a practice that's in the top 1% of private practices in the country, did you know that? And I'm like, no, doesn't everybody do it this way? Like, what? No. And they're like, no, this is great, you should share with people. And so I got that idea that people want to hear what I'm doing, and that's there's a piece of ego in there, a little bit, that starts with, oh, I'm relevant, but then when you really start like sharing and you see people absorbing and then you see them going and doing, it's like you're multiplying, right? I can only treat, I mean, I'm fed up to here with 18 or 20 arches a month. I don't want any more. It's a lot of work. I lose my personal life, I lose my sense of purpose, and so there's only, how many millions, hundreds of millions of Americans here without teeth, you got 40 million Americans with no teeth and another 80 million in jeopardy of losing them all. I'm not going to treat them all. So it's nice to just share and help other people to do that kind of work. It's almost like ministry. It's almost like mission, work. You're going out and you're spreading the word of God, and other people get to be enlightened by it. And in dentistry, it's dental ministry. We're going out, we're teaching other people how to do it. It is very rewarding in a emotional or spiritual sense. And you get all kinds of haters on Facebook. Oh, you're in it to make money. You just want people to sign up for your courses. I'm like, you know what I want to do is those like 10 weekends a year where I'm teaching courses, I want to go sit by my pool. That's what I really want to do, because, I make this much money and this is my money with education. This much money, education, but I do it for a purpose. I love it.
Well, first of all, for the haters and everything else, forget them. You're getting on the court. You mentioned that before, right? You're stepping out. You're not just talking from the sidelines. You're actually getting on the court. You're providing, you're doing it from a purpose. So there'll be those distractors. There'll be those type of people. Who cares? You're serving people. They're treating more patients better. So again, we all deal with that in any profession, or most successful people who work hard and do it the right way and do it the purpose. You're going to hear all the noise, but again, who cares, right? You're doing it. You're helping people. So I just want to say that, Julieanne. So sorry.
Well, okay. So I was kind of on the same track, actually, Mike. So, we came together, Mike and I came together and formed this company because we really wanted to elevate people in the space. And we had been on the flip side together, and where people were trying to step on everything, and we knew what that felt like, and so we kept reminding each other, let's take the high road, and so as we did that, we're like, we should just form a company and we should just do the opposite and elevate everybody, right? And look at what has transpired, because we came together really genuinely wanting to lift people up who are giving back and who are generous and who had potential that even went further than the success that they've hit, the pinnacles where everyone's put them on a pedestal, if you will. So a couple of questions of curiosity. I look at you as that person on the other side, right? That person that you used to spend time with back in your childhood where you were, trying to figure out what they did, and now you're there. So being there, I mean, obviously you're enjoying the training. I have been on the training education side. Mike's been on the training education side. We also hold courses and all of that, but I know what it takes to run an institute. And I work with many institutes, but a couple of questions about the institute itself. If you're putting in 90% of your time, right? Like, and I know what you're talking about. It is definitely passion driven, but I have also seen people doing that where they burn out entirely and they don't even want to do education anymore. So what is the fire? What is it? Is there something that you're trying to do behind all of that? Or is it literally just that, my gosh, it's like getting on stage and you love it and then you get a high and then you move on and go back to the moment? I don't know. What is it that keeps you on fire with that?
Yeah, I don't know. I mean, I'm just kind of doing this because I'm enjoying it and it just keeps growing. I mean, it's like everything else I've done in my life, I don't really know where it's going, but I know it's going to a good place. I know that if I were to close, I'm in the institute now, the Atlantic Implant Institute, and if I were to close the doors tomorrow and the classroom that's sitting here behind me, if I were just to use it as a meeting room for staff and say, you know what, those were 5 fun years, I would have no regrets. I'd be like, that was fun. But it could snowball into something bigger. I mean, people are talking, people are wanting to work with us. I want to work with other people. I didn't call it the Hogan Implant Institute for a reason. I wanted it just to be broad. I want to have experts from all areas of the industry coming here and teaching on any given weekend on a different subject in dentistry and just go, here's the keys, there's the classroom, teach away. That's what it's there for. But, we only want to work with good people, and if there's one thing, I mean, there's a dark side of education in this field, especially full arch. A lot of politics. There's a lot of ego. A lot of hidden agendas, which I guess is the same as politics. But we're out here to work with people that are genuine, honest, with high integrity. Okay. So you might see us form relationships with people and then all of a sudden we're just not quite there anymore. That's by design. That's by choice. We're looking for positive people. I'm really excited about some of the things we've got going on. We've got some good people coming in. Knife Sonata's coming in October. We're due FP1. He's
We
going to be
love
here this.
Knife.
I
He's a
love
great
him.
one.
Yeah, we love him. We've shared stage with
Yeah.
him, and he's
Yeah.
such a good guy. And we're going to have him on the show too.
You should. And he'll be here in 2 weeks. We're going to jump out of an airplane together. We're going to do the remote anchorage course and then we're going skydiving on Monday.
Oh my
But
gosh.
he and I, like when I met him, and when two souls just go, this person's a positive, no time for drama, no time for secondary agendas, no time for ego. The universe is bigger than yourself. The things that he and I talk about, I'm like, I can work
Same.
with this guy. I want
One
this guy,
love.
you know? Like, and then, you meet with other people and you think it's going to work out and they're a big name in the industry. And then you realize, it's about themselves, right? It's about themselves or their ego or their money, and you're just like, good luck to you, but we're going to be over here, in this realm, because it's not really about money to us. It's not about money at all. It's about people. It's about passion. It's about purpose. And I can do a lot of things with my time. I mean, I think especially now turning 50, and this has been starts waning on you at 40, right? The time you have, and you turn 50 and you go, now what do I want to do with the rest of my life? What do I want to do with today? What do I want to do at this minute? Because I don't get, there's 440 minutes in a day or something like that. I don't get this minute back. I don't get these 1440 back. What am I going to do with my next minute, with my next day? And who am I going to surround myself with? And is it going to be people with their own hidden agendas or negativity? Or am I going to have a universe full of positive people that they genuinely want what's best for me and I want what's best for them? And that's what the Institute is all about. And, we're going to grow at a slow pace because we're going to be very careful how we grow. But hopefully, institutions that grow more slowly and carefully, hopefully they last more, through time, if you will. And then, one day it'll just be something that I pass off to somebody else and here, it was a good run. Now I'm going to go spend my time on my sailboat. I don't know. But it's fun. It's fun for now. And I enjoy it.
I got to admit, Mike and I have probably been to more courses than we ever should have gone to in our lifetime. And hearing you speak is an absolute pleasure. Hearing so many other people speak and having that comparison in terms of sitting through an education program, I highly encourage people to check out your courses. There's no question, because I have no doubt that they're going to walk away with an unbelievable changed heart and experience, and they're really going to step into their potential because of it. So, like, if you could really boil down everything that somebody might take away from your course to one thing that you hear maybe recurring, or one thing that you'd like them to walk away with besides the clinical skills, what would that look like?
Wow, that's on the spot. That's deep. I mean, there's so much, it's like you got to have the whole picture to appreciate the picture. But if I could pull this like one stroke of paint off that picture, I'd say, just, enjoy what you're doing, and make sure that you are good at it. You're delivering, you're treating people well, delivering good, proper care, and that you're having good purpose in your life, because that's what it's all about. It's not about all on four or dental implants or surgery or it's about that experience. It's about that journey. It's not about where we started. It's not about where we end. It's about the moments in the middle and the journey through the middle. Make sure that you're enjoying it, and make sure that you're satisfied in it, and you're pleasing the people around yourself.
I love that. I'll just chime in on that, and then Mike, you can jump in. I know we're going to come to the end of our time here shortly, but I coach an Olympic athlete as one of my clients. As one of the outside of dental, although he's also in dental, working with oral surgeons, and he shares his journey, and he went through so many ups and downs making it to the Olympics, having to leave, pack his bags the day of the opening ceremony, not getting to compete, then going back again and finally getting to compete, winning fifth. And he said, do you think that my life is about that 2-minute run, or however long it
Right.
was? Or do you think it was more about the journey over that, 15-year stretch? And it was such a great way for somebody who puts people into this, this concept, or they envision people at this high pinnacle of success, and that, that's when you win. It's not about that, right? And so interesting. And I love that you said that. Mike, go ahead. You were going to say something. I apologize.
Yeah, I just wanted to talk about specific people, if you want to share, that have influenced you or been mentors to you, because I do think, again, even though it's a journey for all of us about yourself, and you're overcoming, like you said, getting up in the morning, getting out of bed, putting one foot in front of the other, that is on us as individuals. However, we are motivated or influenced by many before, which in our personal lives, a family member. You mentioned your mother. I'm in love with my mother, everything she did for us and our family. But other people, other mentors, coaches, teachers, others. But I was just curious to share, if you have a couple mentors or influencers in your life that meant something to you, to give a shout out, but also just to share with others that, again, to one, search out mentors, first of all. Two,
Sure.
find those people that motivate you, whether it's an eighth grade teacher you had that motivated you to finish an assignment. I mean, I think about, if you could share with, maybe a personal journey and some of those mentors or influencers in your life that made a difference, and why.
Wow. Whew. There's like there's not enough time. Thousands. It's like, and it's not just all the people, it's all the things that happen in your life, the little things that happen in your life. The boss I had when I was working for Parks and Recreation when I was 14, the things he put me on task to do to learn how to do things the right way. My fourth grade teacher who probably saved me from a fit of depression. There's guardian angel who saved my life from getting hit by a bus one day, when I was like first or second grade. Like, there are so many things that happen in your life that just have such a profound impact, and it's really hard to narrow down to one. I don't know, but I gotta say my Truman Baxter, by the way. I came out of the military and I was looking for a place to practice. I interviewed halfway across the country. I even flew halfway across the country, and I found a guy here in Virginia Beach where I got off my last ship, my duty assignment, about literally right by Little Creek Amphibious Base. And he was a guy who, just impeccable dentistry, true to his word, high integrity, tells it like it is, no bullshit. Some people say he was a hard SOB to work for, because I knew he threw out like 10 or 15 associates before me. But, he went to VMI, and then he was in the Army and I was in the Marine Corps. So we kind of, he tolerated me and I tolerated him for a little while until we became best friends. But he became a huge mentor to me. I was looking for somebody in the country that treated people like people, and that treated friends, not patients, and that did, basically implant dentistry and high-end dentistry that made, because patients hate getting fillings, right? They hurt. I can't imagine being a dentist and doing fillings. That would suck, because people don't appreciate it. They don't appreciate it. But I wanted somebody who got rid of dentures and partials, and this guy did it, and he was right up the street. I saw him the other day, Truman Baxter, he's older than he was then now, and but he's still here, and he still lives in the neighborhood, and I still see him.
That's incredible. I love that. And, you mentioned Sonata earlier, and, we love Knife to pieces. There's some icons out there in this industry who we look up to and also know personally. And he was, one that you mentioned. And I think between you and him, and we have, many others that we could name right here, you guys have really helped even people that we know. You, for one, have really, you really collaborated with Dr. Athena, who I knew when she was just getting started. I knew her when she had placed like 4 implants, back in the day. And she's a dear friend. I absolutely love her. So I appreciate that you also, have brought her into your fold. And so I see the impact because look at her on stages. Go ahead. You were going to say.
Well, no, I mean, I would comment on Athena. She is in our life because she is a beautiful soul. She has a huge heart, and it's genuine, and you can feel it when you're around her. And also, she's humble, and that's one of the things I'd say about Knife too. Is these great people with these little small egos, that they maintain their humility, because in the grand scheme of the universe, in 1 trillion years, okay, I did 5,000 smile. What does it matter? What does it matter? It doesn't matter how many implants I put in today. But this humility that these people have, and people come in here and they're like, oh, Adam Hogan. And I'm like, hey, if you knew the dark side of
This is
Hogan, like if you knew the other side of this, like, hey man, I'm just welcome to my house. I had trouble putting on my pants today. I haven't had my coffee yet. What's your story?
well.
Yeah.
I want to challenge that real quick though. You said, what does that matter? Those 5,000 patients, the 5,000 arches. It matters to them.
Yeah,
And I would tell that to any dentist or anyone. It matters to them. And again, it's not a numbers game. If you did one, it matters to that one person. And
yeah,
we've probably all heard that story, and I'm going to butcher it, so I won't say it, but about the number, the sand or throwing something back into the ocean. It matters. It matters to that patient. It matters to the people you interact with. It matters to that person you coach or train. So
Matters to
again,
the starfish.
it matters. It
Yeah.
matters to the starfish. Yeah,
it
exactly,
does.
Julian. It matters to the starfish.
I know. And I'll say that, this matters to me that you agreed to be on the show. It really means a lot because I know you're busy and I know you're well respected and all of that. And so we appreciate you more than you know. But I always say that, like, I don't think I matter really necessarily to anyone, but yet I also think that everything we do matters and everything we say,
It does.
matters and
It
everything
does.
we touch matters. And if we
Yeah.
make it matter, and it does matter, and somebody, we've all saved somebody's life without knowing it. Like somebody out there was going to kill themselves, and because we interacted
Yeah.
a certain way one day, they didn't, and we take
Right.
that for granted, and we'll never know. We're never going to get a pat on the back for it. And somebody has probably saved all of our lives at some point.
Sure.
And
100%.
so let me ask you though, I am blessed. I have very, very good friends around me, incredible opportunities that I could never be more grateful for than I am now. But some days I still feel really lonely in my own house, married with a family, with best friends, all of it. And I know sometimes it's still even difficult because sometimes I don't even want to pick up and call somebody that
Right.
I love and care about. And I don't want to reveal it. I want to hide it. Right. Do you feel that sometimes? And how do you deal with it if you do?
All the time, probably way more often than we want to admit, and like I said earlier in the show, I said, it's that little voice in the back of your head, comes from your brainstem that says, I can't. That's the doubt, right? That's the evil voice inside that you have to, that's Satan that you have to suppress and you have to fight every day and knock down. I mean, I have my moments of doubt all the time. I mean, I'll walk into like Monday, I've got a patient that nobody else wants to treat, got referred to me by a specialist, bone like thinner than a piece of paper. And I'm like, oh my God, it's probably going to go horrible today. And then, I'm like, I got to go. And you get in there and it's like, boom, pterygoids on point, the smallest pterygoids plates that you've ever seen. Boom, they stick, the zygos stick. You're like, okay. And then you make a difference. And this woman's crying because she never has to wear a denture again. Like at the end of the day, she has her teeth. Makes a difference. That matters. That is something that matters. right? Or, yesterday I'm on the other side of it. I'm going 10 hours on an FP, 8 hours on an FP1, right? About 3 or 4 hour, 5 hour surgery and then 4 hours waiting and, equilibrating everything and delivering. But a whole day procedure for somebody where, another guy was just going to rip out all the bone, but like putting the time into something that because it's the right thing to do, that matters. But I doubt myself all the time. I mean, we have a packed course for atrophic core anchorage in 2 weeks here, and we got some great friends coming down. And I'm telling you, that week I'm probably gonna be like, it's gonna be terrible, it's gonna suck, Like, they're gonna hate me, they're gonna hate it. And then you get up there and everyone's like, this was the best learning experience I ever had in my life, and you're like, okay, and you get that reaffirmation every time.
Yeah,
But
I'm going to tell you, even you saying right away without hesitation that yes, all the time for you, that you feel that that sensation literally allowed me to breathe, because I'm like, what's he going to say? Maybe he never
yeah,
feels lonely.
yeah.
So it's crazy, but it's like it makes such a difference to know that, we're human, and that, we're not alone when we see people of your caliber, and you can share all these secrets to how you got here and all the success. And yet you're still day to day,
Right.
you have these experiences as well. Do you turn to somebody? Do you call somebody or tell somebody when you're going through that?
Sure, I confide in people. I'll confide in my team. Like that if there's trust there, I'll confide in anybody. If they want to listen and they're there for me and I'm there for them. My wife and I are the strongest bond on the planet. Just we are always checking in. How are you? What's going on? What can I do? We talk things out all the time. And we listen to each other. So that is having a partner like that in your life that is always there for you and you got to always be there for them. That is just like, earth shattering, divine type, presence.
Yeah.
But letting, everywhere your kids, they know that they can come. I mean, I got two older kids and they're 18 and 22 boys and 23. And then we just had another one.
Oh
So
my gosh,
Congratulations.
stop.
we,
When? Congratulations. Are you kidding?
yeah,
That's a big stretch. That's
yeah.
amazing.
Well, I had them with my ex-wife, my older
Yeah.
ones, right? And then, which is another, traumatic experience. But like
Always.
I had two great boys out of it. And then my oldest is graduating high school, and Allie and I wanted to have a family together. And there were some mixed feelings about that even 2 or 3 years ago. With do you want to do all this over again? But at the end of the day, I can't think of a better use of my time. It's all about time. We have some money, we have some things, we travel a ton, and I want to keep traveling, and we're going to. But like I never look at one of my kids and go, like I wish I didn't have you. Like you're always going to want your
You
kids, right?
don't? Wait, wait, is that just me? No, I'm just kidding.
Well, wait, are they teenagers?
A
Because they're
teenager, and I would
yes,
never trade her for the world. And I started over because I adopted younger ones. So I have a 4 year
yeah.
old and a 7 year old and a teenager, a 15 year old. They're all amazing, and I'm the same way. And I actually can't say I won't bring in another at some point. Like I literally can't say that I wouldn't do it.
And if I don't
If
say I love my kids, I'm going to be in trouble as well. So I have a daughter and a son, dad in their late 20s as well, and I wouldn't trade them for
yeah,
the world either. So kids are wonderful. Unless you have your own, you can't really speak on it. So
And just for safety, our spouses too. We love our spouses. We're going to do an
yes,
episode
we
one
do.
day where we honor our spouses too.
Yes, of
yeah.
course.
Since
Well,
you're making us look bad, Dr. Hogan, stop it.
hey,
But
you
you are
got to
right.
give gratitude and
Yes.
give it where it's due, right?
So how
Yeah.
old's your
So
baby?
he's a week old.
My
Wow.
gosh, this is like huge. And you still made the show. I'm
Yeah.
so grateful. We have to let you go on that note. I mean, come on. Thank you so much for being on this show today. I'm so thrilled that you came on here. I'm going to text Knife Sonata right after this and tell him that you were giving him mad props on the show so he can tune in when we release it. We'll let you know also when this will be released. But Mike, do you have any last questions before we wrap up the show today? And then we'll
No.
let Dr. Hogan say a few last words.
Yeah, no, I'm very thankful for you to be on the show as well, Dr. Hogan. It's a pleasure, and everything that you're saying resonates with me. And I obviously have personal friends that are Marines. So, again, thank you for your service on that. I appreciate you and all the men and women in service for our country. And just, again, the humility. Again, it's okay. I don't care who you are, the president or whoever, any corporation thing, you can take out the trash. You can do an intraoral scan. You can, fill someone's cup of water and give it to someone. And you could and do it with a smile and a real purpose. So again, thank you. And thank you for serving that. Like Julianne said, I've been in education and sales and stuff all my life. And again, at the end of the day, it is about the patient, treating more patients better. The dollars will come. You do right by your patient and everyone else, but it's the journey and everything else. So again, I just want to thank you directly as well. And I know our audience has really enjoyed this and we'll get a lot out of it as well. And as Julianne alluded to before, we'd love to work with you. And I think we will in the future for a lot of different reasons. And again, Julianne, thank you for a great episode as well.
At minimum, we want to pop in and meet your wife in case that we want that open door. But yeah, so thank you. And are there any last words or anything else, if you could, share anything as a kind of closing for our listeners today? And then also, can you share with the listeners how somebody can reach you, how they can enroll in courses if they want to, and the whole nine?
Sure. Oh, I'll start there. The Atlantic Implant Institute.com, we have a website. It's got a calendar with courses from month to month. It's got a drop down menu. If it's too much information or not enough for you, just call, DM, we'll get back to you. We've got a full staff. So we'll figure out what you need, what you want. No problem there. I'm looking forward to seeing you two in Virginia Beach. I know you're in California, I believe, right?
Yes.
Well, I'm in Phoenix. Julianne's in California.
Okay. Yeah. Well, you can look at our calendar. If there's something you want to attend, just let me know. I'd love to meet you two in person again, actually,
Yes.
Julianne. And, second part of the question was what?
Just if
Some
you could
parting words.
share anything that you have this opportunity. This is going to be a legacy show that is out there for who knows, as long as there's the internet, honestly. And so you never know, you might be dead someday and somebody will still be tuning in and listening. And so any parting words, make it good. Now that I've built it up. No, I'm just kidding.
Wow. Set the
No
bar
pressure.
high. Oh my
Hope
gosh.
you came prepared.
Let me look up Socrates and see if he's got any advice.
Chat GPT, parting words for a
parting
podcast.
words. I know. Wow. Actually, that's a really good idea. Do you think people would notice me typing? Look, I mean, yeah, we had a baby a week ago. Brecken, a boy, beautiful baby boy. It's good time spent. Being here on this podcast was really no big deal. I have a lot of gratitude for you asking me, because when you reached out to me, Instagram and a DM, I'm like, who am I to sit on a podcast? Nobody wants to hear what I have to say, right? That's that voice in the back of your head. But, I have a lot of gratitude for this opportunity to, just kind of help other people and, contribute to the universe in a positive way. Certainly know that I have a lot of making up to do for past life experiences. But yeah. So, I mean, if I had to share anything with parting words for people, just, have gratitude for where you're at, work hard, endeavor to be a better person. And, if you treat people right, I mean, the money will follow. Don't worry about the money. Don't worry about the implants. Just do good work and be a better person. Build your reputation as your brand. Okay. Or not some, catchphrase or implantologist or all-in-four specialist or whatever. Just build your reputation as a good quality person that does good work.
I love that. Thank you so much. Awesome parting words, honestly, and so much from the heart. I would be remiss if I didn't mention American Dental Institute, who is a collaborator for this podcast. And you can check them out. They have an annual event, which is coming, ADI2025.com. There's an awesome lineup of speakers. Always, they have incredible people who come in. Dr. Hogan, you should definitely be speaking on that stage at some point if you're willing. And then also people can follow us on social media at Influential Dental if they want. We each have our own private accounts as well. You can find us by our names or Google us. But we really appreciate the listeners tuning in. Mike, I'll let you wrap it up.
Yep. And again, it was a great show, action packed, and we got to learn a lot about ourselves in this as well. So again, Dr. Hogan, thank you for inspiring those and sharing your personal journey. And for everyone, there is hope. Reach out, work together on yourselves or with your teams. And again, Julianne, thank you. And I look forward to meeting you in person, Dr. Hogan, as you had said. I think there's a lot of great things that can be done. And again, I know I appreciate you as well. So again, thank you. Thank American Dental Institute, and have a great rest of your day and enjoy that new baby. I'm very excited for you and your wife.
Thank you very much.
Thank you.